If you are over 60 and experience sudden heart palpitations, irregular heartbeat, or unexplained anxiety, the cause may not be your heart alone. Many seniors are unaware that low magnesium can disrupt the heart's electrical rhythm. Magnesium helps keep heartbeats steady and calm. When levels drop too low, the heart can become unstable, leading to dangerous rhythm problems. In this video, a doctor explains how low magnesium silently affects the heart in seniors, the warning signs you should never ignore, and why this deficiency is more common than you think. Magnesium is an essential mineral that plays a critical role in keeping the heart's rhythm stable. Inside the body, magnesium helps regulate electrical signals that control how the heart beats. It works closely with potassium and calcium to ensure each heartbeat is smooth and coordinated. When magnesium levels are normal, the heart's electrical system remains calm and balanced. However, as people age, maintaining adequate magnesium becomes more difficult. Absorption in the digestive system may decline, and dietary intake often decreases. Many seniors also take medications that interfere with magnesium balance. Over time, this can quietly lower magnesium levels without obvious warning signs. The heart may continue functioning, but its electrical stability becomes more fragile. Small disruptions that would not affect younger adults can trigger noticeable rhythm changes in seniors. This is why low magnesium is often linked to palpitations, skipped beats, or irregular heart rhythms. Understanding magnesium's role helps explain why heart symptoms can appear suddenly, even when no structural heart disease is present. Low magnesium affects the heart by increasing electrical excitability. Without enough magnesium, heart cells become more reactive and less controlled. This makes it easier for abnormal rhythms to develop. Seniors are especially vulnerable because aging heart tissue is already less flexible and more sensitive to stress. Magnesium also helps regulate calcium movement in heart cells. When magnesium is low, calcium can enter cells too easily, causing excessive contraction and irregular signaling. This imbalance may lead to rapid heartbeats or erratic rhythms. Another concern is that magnesium helps the heart relax between beats. When levels drop, the heart may struggle to fully relax, increasing strain over time. These changes may not cause immediate pain, but they create instability. Seniors might notice subtle signs such as restlessness, mild anxiety, or a racing heart at night. Because these symptoms are not always dramatic, they are often dismissed. However, they reflect real electrical changes occurring within the heart that deserve attention before they progress. One reason low magnesium is frequently overlooked is that its symptoms overlap with common aging complaints. Fatigue, poor sleep, muscle tension, or nervousness are often blamed on stress or getting older. Yet, magnesium plays a key role in nerve and muscle relaxation throughout the body. When levels fall, both muscles and nerves become more irritable. In the heart, this irritation appears as rhythm disturbances. In the rest of the body, it may show up as cramps, twitching, or trembling. These signs often occur together, but the connection is rarely made. Blood magnesium levels are not always checked during routine exams, allowing deficiency to persist. Seniors who have low magnesium may also have difficulty maintaining stable potassium levels, compounding heart rhythm risk. This interaction makes magnesium deficiency particularly dangerous. Without awareness, seniors may focus on treating symptoms rather than addressing the underlying imbalance. Recognizing magnesium's broad role helps explain why heart symptoms often appear alongside seemingly unrelated discomforts. It is important to understand that magnesium deficiency does not need to be severe to affect the heart in older adults. Even mild reductions can destabilize heart rhythm in seniors. This increased sensitivity means prevention and awareness are essential. Seniors with a history of heart disease, high blood pressure, or arrhythmias are at higher risk. However, even those without known heart conditions can be affected. Low magnesium often develops gradually, making it easy to miss until symptoms appear. By understanding how magnesium supports electrical balance in the heart, seniors can better appreciate why early signs should not be ignored. This foundation is critical for recognizing symptoms, identifying causes, and knowing when evaluation is needed. In the next part, we will focus on the specific heart rhythm symptoms that low magnesium can trigger. These symptoms are often subtle at first, but can become serious if the underlying deficiency is not addressed in time. One of the earliest heart-related symptoms of low magnesium in seniors is irregular heartbeat. This may feel like fluttering, skipping, or sudden pounding in the chest. Some seniors notice their heart racing briefly, then returning to normal without warning. These sensations occur because magnesium helps calm the heart's electrical activity. When levels are low, electrical signals can fire too easily, creating unstable rhythms. Palpitations may happen during rest or sleep, which can be confusing and alarming. Many seniors expect heart symptoms only during physical activity. Low magnesium can also cause a sense of internal restlessness or unexplained anxiety linked to heart rhythm changes. The heart may beat faster or less efficiently, leading to early fatigue. These symptoms often come and go, making them easier to dismiss. However, intermittent symptoms still indicate electrical instability. Recognizing these early warning signs is essential because they often appear before more serious rhythm problems develop. Early awareness allows seniors to seek evaluation before symptoms escalate into dangerous arrhythmias. Another common symptom associated with low magnesium is dizziness or lightheadedness. When heart rhythm becomes irregular, blood flow to the brain can briefly decrease. This may cause unsteadiness, blurred vision, or a feeling of faintness. In seniors, these moments are especially dangerous because they increase fall risk. Some older adults also experience shortness of breath without exertion. This occurs when the heart struggles to pump efficiently due to electrical instability. The body senses reduced oxygen delivery and responds with rapid or shallow breathing. Chest discomfort may also occur, ranging from mild pressure to tightness. While not always a heart attack, this symptom should never be ignored. Low magnesium can worsen existing heart conditions, making symptoms more noticeable. Seniors with previous heart disease may experience these signs earlier and more intensely. Unfortunately, dizziness or breathlessness is often blamed on aging, delaying evaluation when early treatment could prevent serious complications. In more advanced cases, low magnesium can trigger serious arrhythmias. These rhythm disturbances may cause the heart to beat erratically or inefficiently. Some arrhythmias reduce blood flow to vital organs, leading to confusion, weakness, or near-fainting episodes. Others increase the risk of sudden cardiac events if untreated. Seniors are particularly vulnerable because their hearts are less adaptable to rapid electrical changes. Nighttime symptoms are also common. Some seniors wake suddenly with a racing heart, sweating, or a sense of panic. These episodes are often mistaken for anxiety or nightmares. However, magnesium levels naturally fluctuate overnight, making symptoms more noticeable. Muscle cramps, tremors, or twitching may occur alongside heart symptoms, offering an additional clue. When heart rhythm changes appear together with muscle or nerve symptoms, magnesium deficiency should be strongly considered. Understanding these patterns helps seniors recognize when symptoms point to an underlying imbalance rather than isolated discomfort. The most concerning feature of low magnesium-related heart symptoms is their unpredictability. Mild palpitations can suddenly progress to serious rhythm disturbances without much warning. Seniors may feel fine for days, then experience intense symptoms unexpectedly. This inconsistency often creates false reassurance. However, irregular symptoms still indicate electrical instability. Ignoring them allows the deficiency to persist and worsen. Low magnesium can also amplify the effects of certain heart medications, increasing rhythm risk. Seniors should never assume symptoms are harmless simply because they fade. Any new or unusual heart sensation deserves attention. Early recognition and evaluation can prevent life-threatening complications. In the next part, we will examine the hidden causes that silently lower magnesium levels in seniors. Understanding why magnesium deficiency is so common helps explain how this problem often develops unnoticed and what steps can reduce risk before serious symptoms occur. One of the most common hidden causes of low magnesium in seniors is medication use. Many older adults take drugs that gradually deplete magnesium without obvious warning. Diuretics used for blood pressure or heart failure increase magnesium loss through urine. Acid-reducing medications, including proton pump inhibitors, can interfere with magnesium absorption in the gut. Over time, this combination quietly lowers magnesium levels. Seniors often take these medications daily for years, allowing deficiency to develop slowly. Because symptoms appear gradually, the connection is rarely made. Another contributing factor is reduced absorption with age. The digestive system becomes less efficient, making it harder to absorb minerals from food. Even when intake seems adequate, magnesium levels may still decline. Kidney function also changes with age, affecting how magnesium is regulated and stored. Together, these age-related factors create a situation where magnesium loss exceeds intake. The body adapts at first, masking symptoms, but the heart becomes increasingly sensitive to electrical instability as levels continue to fall. Dietary habits play a major role in magnesium deficiency among seniors. Many older adults eat smaller portions or rely on processed foods that are low in magnesium. Whole grains, nuts, seeds, and leafy greens are rich sources, but they are often limited due to chewing difficulty, digestion concerns, or dietary restrictions. Some seniors avoid these foods without realizing their importance. Dehydration further worsens magnesium loss. When fluid intake is low, the body loses electrolytes more easily. Episodes of vomiting, diarrhea, or excessive sweating can rapidly drain magnesium stores. These events may seem temporary, but recovery is often incomplete. Stress on the body also increases magnesium demand. Illness, surgery, or chronic inflammation can shift magnesium inside cells, lowering blood levels. Over time, repeated stressors gradually reduce reserves. Without awareness, seniors may unknowingly move from normal magnesium levels into deficiency. This slow decline explains why symptoms often appear suddenly, even though the process has been ongoing for months or years. Chronic medical conditions common in seniors can also contribute to low magnesium. Diabetes increases magnesium loss through urine, especially when blood sugar is poorly controlled. Gastrointestinal disorders may reduce absorption, even when intake is sufficient. Kidney disease affects how magnesium is filtered and retained, increasing imbalance risk. Hormonal changes and inflammation can further disrupt regulation. Another overlooked factor is alcohol consumption. Even moderate intake can interfere with magnesium absorption and increase loss. Over-the-counter products also matter. Some laxatives, herbal supplements, and weight loss products alter electrolyte balance. Because these are not prescription medications, seniors may not mention them to their doctors. This makes deficiency harder to detect. Magnesium deficiency often coexists with low potassium or calcium, compounding heart rhythm risk. When multiple electrolytes are affected, symptoms may be more severe and unpredictable. Understanding these overlapping causes helps explain why magnesium deficiency is widespread and often missed in older adults. The real danger of these hidden causes is how easily they overlap in daily life. A senior may take magnesium-depleting medications, eat a low magnesium diet, and experience dehydration at the same time. Each factor alone may seem minor, but together they significantly increase risk. Because the body adapts slowly, symptoms may not appear until magnesium levels are already low. By then, heart rhythm may be unstable. This is why awareness is critical. Magnesium deficiency is rarely caused by one single issue. It is usually the result of multiple small factors accumulating over time. Recognizing these patterns allows for earlier intervention and safer management. In the next section, we will discuss when seniors should seek medical testing and evaluation for magnesium levels. Knowing when to test can prevent serious heart rhythm complications and help ensure corrective steps are taken before symptoms become severe or life-threatening. Knowing when to check magnesium levels is essential for seniors who experience heart rhythm symptoms. Any new palpitations, irregular heartbeat, dizziness, or unexplained anxiety should prompt medical evaluation. These symptoms may seem mild, but they often signal electrical instability in the heart. A simple blood test can measure magnesium levels and help identify deficiency. Seniors who take diuretics, acid-reducing medications, or have chronic conditions should consider routine monitoring. Testing is especially important after illness, dehydration, or medication changes. Unfortunately, magnesium is not always included in standard blood panels, so it may need to be requested. Early testing allows for safe correction before symptoms worsen. Waiting until symptoms become severe increases risk and limits treatment options. Magnesium testing is straightforward and provides valuable insight into heart health. Seniors who understand the importance of early testing are better equipped to prevent dangerous rhythm problems rather than reacting to emergencies later. Certain symptoms require urgent medical attention. Severe chest pain, fainting, confusion, or sustained irregular heartbeat should never be ignored. These may indicate serious arrhythmias linked to low magnesium. Emergency evaluation allows doctors to assess heart rhythm and stabilize electrolyte levels quickly. For less severe symptoms, scheduling a doctor visit is still important. During evaluation, healthcare providers review medications, supplements, and medical history. An electrocardiogram may be used to assess rhythm changes related to magnesium imbalance. Seniors should always disclose all over-the-counter products they use. Some supplements and laxatives can affect magnesium levels. Avoid self-diagnosis or self-treatment. Magnesium levels that are too high can also be dangerous, particularly for those with kidney disease. Medical supervision ensures safe and appropriate correction. Clear communication with healthcare providers improves outcomes and reduces risk of complications. Treatment for low magnesium depends on severity and underlying cause. Mild deficiency may be corrected through dietary changes, while more significant cases require supplements or intravenous replacement. Doctors determine the safest approach based on blood levels and overall health. Seniors with kidney disease or heart conditions require special caution. Rapid correction can affect heart rhythm if not carefully monitored. Follow-up testing is often needed to confirm that magnesium levels have stabilized. In many cases, ongoing monitoring becomes part of routine care. Medication adjustments may also be necessary to prevent recurrence. Education plays a vital role in prevention. When seniors understand how lifestyle, hydration, and medications affect magnesium, they gain control over their health. Caregivers and family members can assist by helping track symptoms and appointments. Proper treatment not only relieves symptoms, but also supports long-term heart stability and reduces hospitalizations. The key message is that magnesium imbalance is manageable when detected early. Seniors should view testing as preventive care rather than a response to crisis. Regular checkups and open communication with healthcare providers create protection. Monitoring magnesium is especially important for those with multiple risk factors. Awareness reduces fear and uncertainty. By understanding when to test and how magnesium affects heart rhythm, seniors can take proactive steps. This approach supports independence and confidence in managing health. In the final part, we will focus on practical strategies seniors can use to maintain healthy magnesium levels safely. These steps help prevent recurrence and support heart rhythm stability over time. With the right knowledge and guidance, seniors can protect their hearts and continue living active, fulfilling lives without unnecessary risk from hidden electrolyte imbalances. Maintaining healthy magnesium levels begins with consistent daily habits. For most seniors, food is the safest and most natural source of magnesium. Nuts, seeds, whole grains, legumes, and leafy green vegetables provide magnesium in forms the body can absorb gradually. Eating a variety of these foods helps support steady levels rather than sharp fluctuations. Portion size matters less than regular intake. Hydration also plays an important role. Adequate fluid intake helps the body regulate electrolytes and reduces unnecessary magnesium loss through urine. Seniors should drink water throughout the day instead of waiting until thirst appears. Medication management is another key factor. Seniors should review all prescriptions with their doctor and ask whether magnesium monitoring is necessary. Never stop or change medications without medical guidance. Small, consistent habits work together to protect heart rhythm. By focusing on daily nutrition, hydration, and communication with healthcare providers, seniors can support magnesium balance and reduce the risk of heart rhythm disturbances. Magnesium supplements require special caution in older adults. Supplements should only be taken when recommended by a healthcare professional. Taking too much magnesium can cause side effects such as diarrhea, weakness, or dangerously low blood pressure. Seniors with kidney disease are particularly vulnerable to magnesium buildup. Blood testing helps guide safe dosing and prevents complications. Seniors should also be cautious with products labeled as natural or herbal. Some contain magnesium in concentrated forms without clear dosing instructions. Reading labels and asking questions is essential. Lifestyle factors also influence magnesium balance. Gentle physical activity improves circulation and supports overall electrolyte regulation. However, excessive sweating without proper fluid replacement can increase magnesium loss. Managing chronic conditions such as diabetes or digestive disorders also supports balance. When underlying health issues are well controlled, magnesium levels are easier to maintain. Safety comes from moderation, awareness, and medical supervision rather than self-experimentation. Consistency over time is what protects seniors from magnesium-related heart rhythm problems. Skipping meals, dehydration, or irregular supplement use can quickly disrupt balance. Establishing routines helps prevent these fluctuations. A regular eating schedule that includes magnesium-rich foods supports stability. Seniors should also pay attention to early body signals. Muscle cramps, tremors, sleep disturbances, or increased nervousness may indicate shifting magnesium levels. Addressing these signs early helps prevent escalation. Regular checkups allow doctors to track trends rather than reacting to emergencies. Education empowers seniors to make informed choices. Understanding magnesium's role reduces fear when symptoms appear. Family members and caregivers can assist by encouraging balanced meals and hydration. Open communication allows for timely adjustments. Over time, these small actions build confidence and reduce risk. Stable magnesium levels support not only heart rhythm, but also muscle relaxation, nerve function, and overall well-being. The goal of magnesium management is balance, not perfection. Seniors do not need extreme diets or constant worry. Awareness and routine care provide protection. By understanding risk factors, recognizing symptoms, and following medical advice, seniors can manage magnesium safely. This reduces the likelihood of dangerous heart rhythm problems and sudden complications. Magnesium supports calm electrical signaling in the heart, helping maintain steady, reliable beats. When magnesium levels are stable, daily life feels more predictable and secure. The most effective approach is proactive care rather than emergency response. Seniors who stay informed and engaged in their health are better prepared to prevent problems before they become serious. In the final conclusion, we will summarize the key points and reinforce simple steps that help protect heart rhythm over time. With the right knowledge and guidance, seniors can live confidently, knowing they are actively supporting their heart health and overall quality of life. Low magnesium is a common but often overlooked problem in seniors, especially when it comes to heart rhythm health. Throughout this video, we have seen how magnesium plays a vital role in calming the heart's electrical system and keeping each heartbeat steady and coordinated. When magnesium levels drop too low, the heart becomes more excitable and unstable, increasing the risk of palpitations, irregular heartbeat, dizziness, and potentially dangerous arrhythmias. What makes this issue especially concerning is how quietly it develops. Many seniors experience early symptoms but assume they are simply part of aging, stress, or poor sleep. We also explored why low magnesium is so widespread in older adults. Medications, reduced absorption with age, dehydration, dietary changes, and chronic medical conditions often combine to lower magnesium levels over time. Rarely is there just one cause. Instead, small factors gradually add up, creating risk without clear warning signs. Understanding these causes helps seniors realize that magnesium deficiency is not unusual and not a personal failure. It is a manageable health issue when recognized early. Recognizing symptoms is one of the most important steps in prevention. Irregular heartbeat, unexplained anxiety, muscle cramps, poor sleep, or dizziness should never be ignored. These are signals from the body that balance may be shifting. A simple blood test can help confirm magnesium levels and guide safe treatment. Early testing allows doctors to correct deficiencies gradually and safely, reducing the risk of serious heart rhythm problems. Maintaining healthy magnesium levels does not require extreme measures. Consistent nutrition, proper hydration, and regular medical monitoring are often enough. Magnesium-rich foods, eaten regularly in moderate amounts, support stable levels. Supplements should only be used under medical guidance, especially for seniors with kidney or heart conditions. Too much magnesium can also be harmful, which is why balance and supervision matter. The key message is awareness, not fear. Seniors who understand how magnesium affects their heart can respond calmly and proactively to changes. Staying informed, communicating openly with healthcare providers, and paying attention to early symptoms helps protect heart rhythm, independence, and quality of life. Aging does not mean losing control over health. It means adapting with knowledge and care. If you or a loved one is experiencing symptoms discussed in this video, consider speaking with a healthcare professional. Early action can make a meaningful difference. Thank you for watching, and take care of your heart.